Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, it's my job as per usual to share with you the Heoc situation report for today, Wednesday, March the 24th. The Federation would have reported a total of 44 confirmed cases of COVID-19 between last year, March, to present. I want to advise the general public that 42 of these cases have fully recovered, and at present we only have 2 active cases. They are stable and they are being monitored as we speak. The coronavirus started in China in December 2019. Between then and now, over 2.7 million persons have died globally, and over 123.9 million persons have been impacted by this disease. In the United States of America, over 543,000 persons have died, and over 29.9 million persons have been confirmed with COVID-19. In the Caribbean region, in the CARICOM member states in particular, over 124,000 persons have been impacted by way of a diagnosis of COVID-19, and over 2,000 persons have died. In terms of the Organization of Eastern Caribbean States, what's happening? What's the COVID-19 status here? Well, in Antigua and Barbuda, over 1,000 persons have been diagnosed with COVID, with 28 deaths. In Barbados, over 3,500. In St. Lucia, over 4,000 persons. In St. Vincent and the Grenadines, 1,700. And these islands, similar to St. Kitts and Nevis, they've been rolling out their COVID-19 vaccination program. And the first row gives you an idea as to where they are at. And so we can compare. Barbados is way ahead. They have administered at least 54,631 doses of the COVID-19 vaccine. Antigua and Barbuda, 24,000, Grenada, over 9,000, St. Lucia, 19,552. Now, in St. Kitts and Nevis, we would have commenced our COVID-19 vaccination program 4.5 weeks ago, more specifically on Monday, February the 22nd. And in just this short period of time, based on the figures that just came in, we would have vaccinated, or we would have administered, a total of 8,123 doses of the COVID-19 vaccine. So this is dose 1. So let me repeat, based on the figures that just came in, we would have administered 8,123 doses. We would have reached a target population, meaning 24.6% of our target population. Just this afternoon, we would have received the results of the last batch of RUSVN students who would have come into country 2 weeks ago, 2 Wednesdays ago, a total of 76 students. All results returned negative, and so the students will be released this afternoon. To date, we would have tested over 11,000 persons with a positivity rate of 0.3%, because we would have only had 44 results returning as positive. And so this just confirms or underscores that 42 persons would have recovered. We have 2 active cases, 2 are in isolation, And then this just shows how many persons would have been released from quarantine between last year to present. All right, so this afternoon, again, the focus is on the Oxford Astrozeneca vaccine that we are rolling out. And just again to empower individuals who have not yet taken the vaccine, just to provide you some additional information. And so this vaccine once you would have taken the 2 doses of this vaccine, there is an 83% reduction in risk of your contracting COVID-19. So once you would have been vaccinated, there is a significant risk reduction in contracting COVID-19. We are giving 2 doses, that's the dosing schedule we are using, 2 doses 10 weeks apart. We are administering this vaccine to all adults, those over 18. It's very effective against the emerging SARS-CoV variant that was identified in the United Kingdom. And it's with pleasure that we share with you that the side effect profile of this vaccine is favorable. And again, we want to underscore that this vaccine, in the batch or the doses we are administering, they were manufactured by the Serum Institute of India. Just Monday of this week, AstraZeneca Oxford released some information, data coming out of a phase 3 trial. One cohort of this trial took place in the Americas, whereby they analyzed data from over 32,000 participants who were primarily in the United States, some were in Peru and Chile. It's interesting to note that 20% of these participants were over the age of 65 years. Yes. So yes, this vaccine is safe in older persons over 65. And over 60% of the participants had comorbidities, meaning they were suffering from a number of chronic conditions, including diabetes, hypertension, asthma, etc. Now, the information or the data coming out of this study revealed that there is a 79% reduction in risk in getting active or symptomatic COVID infection after receiving 2 doses of this vaccine 4 weeks apart. So that's interesting to note. And then again, I want to use this opportunity to highlight that the WHO advises that if you give the 2 doses 8 to 12 weeks apart, the efficacy increases to over 80%, or in particular 83%. The data coming out of this new study showed that the vaccine is 100% effective against severe COVID and hospitalization. What does that really mean? It means that once you are fully vaccinated with the AstraZeneca Oxford vaccine, it prevents you from getting severe COVID disease. It prevents you being admitted into the ICU and going on the ventilator, etc. So it's very safe and it's effective. And the data also showed that there is no evidence of the vaccine being associated with thromboembolic events or any rare blood clots, as highlighted 1 week ago in the European Union. And it's interesting to note that at present, at least 4 of the European countries have resumed using this vaccine: Germany, France, Italy, and Spain. Okay, so access is an issue. So let's talk about access to the COVID-19 vaccine. So at present, the Federation we have in hand, we are using our first 2 batches, which amounts to 20,000 doses. So in other words, the Ministry of Health, we are targeting the first 10,000 persons with these doses. All right, so our aim is to reach and administer the first dose of 10,000 persons by April 16th, 2021. Let me repeat, our aim, our goal, our target is to reach the first 10,000 persons within the Federation and administer the first of 2 doses of this Astrozeneca Oxford vaccine. And our aim is to reach the 10,000 mark by long before April 16. Yesterday we were asked a number of questions about other shipments, and so yes, the COVAX facility, you were told that the Federation signed on to this global facility way back in October of last year. We would have paid our down payment, and we have 21,600 doses allotted to us. So that means we can cover an additional 10,800 persons within the Federation. Based on information coming out of the facility, we hope to receive 7,200 doses in March of this year, 7,200 doses in April, and 7,200 doses in May. And so between now and May, we can cover an additional 10,800 persons. So if you do the calculation, as a federation, our hope, our aim is to cover or provide coverage for 70% of our population, which is our adult population based on our last census. And so if you see the maths, we have a deficit of about 25,000 doses. And so the Ministry of Health and our cabinet, the leadership of the Federation, we are doing all we can to access these additional 25,000 doses. Access to COVID-19 vaccine is crucial to curbing the spread of the COVID-19 infections. Our aim is to reach the herd immunity threshold by June, July of this year. Yes, that's our aim. And the quicker we get there, the better it is for our health system and for the social, economic context of our federation. And so it's an all-of-society approach, and we are appealing to everyone in the federation. We want to thank those who have already come on board and said yes and consented to taking their first dose. And so we are reaching out to the others in terms of empowering yourself with the information, and we are asking you to make an informed decision, come on board, and help us attain this goal of reaching our herd immunity threshold. Why is this so important? Because if we are successful in vaccinating 70% of our population, it means the adult population will be circulating in our federation with that natural immunity against the virus. And so if we were to accept inbound passengers by air, by sea, the risk of clusters developing will be much reduced. The risk of our going into community transmission will be considerably reduced, because the herd immunity provides indirect protection to the vulnerable and to those who cannot be vaccinated. And so that's why we are imploring our people to come on board. The CARICOM member states, they are comparing themselves. This is circulating. St Kitts is 6 from the bottom. So we need to really get up and vaccinate. Get the facts, choose the vaccination. It's our best shot at protecting ourselves, protecting our families, protecting our community, and rebuilding our economy. I was told yesterday that individuals or persons are not seeing the link between taking the vaccine and opening up or is the resurgence in the economy that we are speaking about. So let me try and break this down. All right, so if each of you say yes and consent to taking the vaccine, we would reach our herd immunity threshold, And when we do, all of us who would be vaccinated would provide indirect protection to our children who cannot receive the vaccine and to the few adults who have other serious illnesses like cancer who can't take the vaccine. And so if we were to achieve this goal, then we'll be able to relax our health and travel protocols. What does that mean? Then we can shorten the quarantine period from 2 weeks to maybe a few days, or who knows, no quarantine at all. Then in so doing, you would see an increase in the number of visitor arrivals by air and probably by sea, because we hear that the cruise industry is going to start soon. More money will be circulating in the economy. And so those persons who have started businesses at home, you will see an increase in the number of patrons, and more money will be circulating in all the subsectors of our society. Get the facts, choose the vax. Thank you.